Well, my name is Dr. Jennifer Taylor. I practice in Plano, Texas, which is north of Dallas. I've been in practice for 17 years now. It's been a long journey for me. I started right when I graduated from high school as a chiropractic assistant. So my whole, I guess, work life has been in chiropractic, which I didn't think I'd actually become a chiropractor because I went to massage therapy school, did that for 8 years. And then I decided one day that being a chiropractor was definitely for me. It actually started, I've been thinking about it. I mean, it wasn't something that I just, just one day I said, okay, I'm going to be a chiropractor. It was more or less a experience that I had in the chiropractic office that I was working at. A couple walks in with a 12-day-old baby, and that baby had difficulty breathing. I mean, sleep apnea all day long. Basically, you just stopped breathing, and they had to essentially resuscitate the baby each and every time. And the doctors couldn't figure it out. She had a pretty traumatic birth, but I mean, there's a lot of traumatic births out there. So what made her so special in this particular situation? The doctors couldn't figure it out. So somehow they ended up on the doctor's doorstep. And we did some testing, and apparently this upper cervical area was misaligned. So we know that the respiratory centers lie in that particular area, at the very base of the brainstem. And so the doctor felt of the atlas and did an alignment, and that baby just sprung with life. So it was at that moment I was like, okay, I need to really look into this. So it took me a bit to really jump into it, but here I am now, more than 17 years later after my schooling, that I'm now an upper cervical chiropractor, and I wouldn't think of it any other way. Once I saw that adjustment, and how it actually not only helped me, but helped such a helpless, tiny little thing, it just occurred to me that the upper cervical work is where it is with chiropractic. It's a specialty within the chiropractic profession. So I guess between here, in America and Canada, there's about 1,200 of us and growing. So that's really exciting. We are seeing a big boom in getting upper cervical out to those that, that have been in practice or new in practice, or really trying to get into the schools to show new students just the benefits of being an upper cervical chiropractor and just the amazing changes that you can see in people's lives and their health with this particular adjustment. Let's see, I have a little bit more training with the upper cervical work. I have about 300 more hours and 3 years of work in and learning of the upper cervical region. I have what they call a diplomate in chiropractic and cranial cervical junction procedures. So it's a DCCJP. Those are the extra letters after my name. And what I loved about the program is that it really brought all of the techniques. There are several different techniques under this umbrella of upper cervical chiropractic. The one that I practice is called orthospinology. It's been around for quite some time, as are all the other chiropractic techniques. But that's the one I chose. It's more versatile. You can use your hand. You can use a handheld instrument. And you can also use a table-mounted instrument. All three are extremely gentle and very, very specific. So those are, some of the reasons why I chose orthospinology. If you want to learn a little bit more about orthospinology, you can go to orthospinology.org, and you can find a doctor there. You can find my bio and everything there as well. But that's the one that I've chosen to practice. Now, as far as me reaching into the community of chiropractic and trying to get the word out about upper cervical, I took on being the vice president of orthospinology just earlier this year. But I'm also director for the International Chiropractic Association Upper Cervical Council. So that way, not only can we start getting more people to look into upper cervical chiropractic as a form of their own healthcare, but also to have students and other doctors become more aware as well. So really kind of getting into these particular organizations can help, to really spread the word, because I know so many people don't know about it. The atlas is also called C1. It's the very top bone in the spine. It actually surrounds part of the brain stem, particularly the medulla oblongata. It has a lot of influence in that particular region. That area controls all of our respiratory function. It controls all of our cardiovascular function, but it also controls all of our postural muscles. So when we look at that in the video, it actually shows how posture will change instantly after an atlas alignment. Now, when I adjust the atlas, I get specific vectors off of very precise x-rays. These x-rays look from the side, exactly where the positioning is of the atlas from the side, as well as from the front and from the back, so I can get like an aerial view of it. So I get a front view, a side view, and an aerial view. So I'm looking at the atlas and all the three planes it can actually move and shift. Now, the reasons why I do that is to get specific vectors. These vectors are very specific to each individual patient, so every patient gets their own individualized adjustment. I actually measure out with a ruler to get my vectors correct. And there's even one vector that is put in there that's dialed into the instrument itself. I prefer to use the handheld instrument. So with that, I'm able to very gently, this is like 1 to 3 taps right behind the ear here. It could be on the right, it could be on the left, kind of depending on how the patient presents on their films. And from there, we actually do the upper cervical adjustment. That's why it looks so gentle, because it's so specific. I don't have to knock anybody into next week to make this adjustment. It is that specific and that gentle. And when you move the atlas, what you're doing is you're influencing that part of the brainstem. In that area, it's so neurologically dense that there are so many different, bottlenecks that can occur there. Those bottlenecks can be anything from, just not having the proper input into those postural muscles. So you have one shoulder that's high, you have a hip that's high. Even forward head posture can be affected by this. That is actually a study that I did for my diplomate program to show that, we have, what do we call text neck, right? That's a big thing. So people are holding their phones like this and they're getting this text neck, where we have a complete, whole generations now of people with forward head postures. Well, after that upper cervical alignment, heads start to come back, posture comes back. So that's one of the first things that we can see. And in the video that I provided that shows the upper cervical alignment from beginning to the end, really shows how those changes instantly take place once those centers are nice and open, and you can actually have that information from the brainstem to the rest of the body actually flowing. Another reason why we can get migraines, headaches, dizziness, things like that are a big thing that we see in upper cervical practices, is because, again, that area can be a bottleneck. Think of that region as the master breaker of the nervous system. When the atlas goes out of alignment, you can actually get the cerebral spinal fluid flow that starts in the brain. We make about 500 cc's in our brain every day, and that flows all the way down to the very bottom of our spine and all the way back up, and then it has to be let out through the internal jugular vein. Well, if there's a bottleneck in that area, a lot of times what we see is some pooling of cerebral spinal fluid flow, basically in the frontal lobe. The frontal lobe is where we make have our decisions made. This is basically who we are. And if that area gets compromised, brain fog, you have things like depression and anxiety and things occur anytime that area is affected. So if that area is affected with this misalignment, we can actually see changes in people's demeanor. They feel more relaxed almost instantly after an atlas alignment. And it's the one thing I want to make very clear about chiropractic in general, and not just upper cervical, but we don't treat diseases. What we do is remove the interference to the nervous system, that system that controls every single thing in your body, so your body can start functioning the way it should. So I'm not treating, depression. I'm not treating anxiety. I'm not treating migraine headaches or anything like that. What I'm doing is we're creating a situation in the body that puts it in a state of ease. If you've ever thought of the origin of the state of disease, it's dis-ease. So the body is not at ease. All chiropractic, especially upper cervical chiropractic, does is it helps the body become more at ease to help that nervous system relax. Now, this area up here, it's more vulnerable to damage. There's no disc above or below the atlas to kind of anchor it in place. Those discs are really fibrous and they really kind of give our spine a lot of stability. However, because we have most of our movement in this area, what happens is that we slip or fall, we get into a car accident, we have a sports injury, especially some sort of head injury. That actually can compromise those ligaments that anchor it. So when those ligaments are compromised, that creates kind of a loosey-goosey situation up there. And when that happens, well, that's when the atlas can go out of alignment, causing a lot of these issues that we see come into our office. It's pretty incredible, some of the cases that we see. So many people in brain fog right now, inability to concentrate. We have, migraines are probably one of the biggest ones we see on a regular basis. I mean, I've had some patients that had a migraine every day for 40 years, and all of a sudden their lives change after their atlas finally gets into alignment. So there is hope for these things. And one of the things that I hoped that people hear is that there is hope. I see so many patients that have spent, years, decades even, really searching for something. They've taken all the medications, which can help, but they keep it at bay. They always come back. And sometimes with some of these medications, they have rebound effects where that migraine comes back even worse. And so it keeps things at bay, that it doesn't change their lives. And, but what I've seen in the 17 years practicing and really 30 years of being in chiropractic, that this technique, the upper cervical work, it actually changes people's lives and helps these issues just go away. And they could be a little more susceptible if there is some ligament damage in that area. I tell you, it's really a privilege to be a part of these people's lives, and even if they're not in my area in Plano, Texas, or a surrounding area, I look forward to kind of helping people find somebody in their area, because we're kind of peppered throughout the U.S. and Canada. There are a few that are in Europe that we're trying to get more there. However, just finding somebody close is really important to make sure that you have the care that you need. The majority of the situations that we see in our office are headaches, dizziness, fatigue, irritability, anxiety, depression, insomnia. I mean, so many people have problems falling asleep these days. Loss of concentration, memory issues, ringing in the ears. That's one we see quite a bit. There's many, many studies on upper cervical techniques, as well as veneers or tinnitus. Blurry vision, sensitivity to noise and light. Those are some of the things that we see on a regular basis in our office that you wouldn't necessarily think about going to a chiropractor about. But once people understand how the mechanics work and how just staying in our lane and our scope of practice, how just relieving this tension and this pressure in the upper cervical region very specifically, very gently, will actually make a huge difference in how they perceive the world. ALS, or Lou Gehrig's disease, that is something that that there has been some research in. It's basically kind of under the umbrella of neurodegenerative diseases. Some of the biggest work is actually being done with multiple sclerosis and Alzheimer's. So you can look at all of those things in a mechanical way. And that's how upper cervical chiropractors look at things, is we look at the mechanics of the upper cervical spine and how does that affect the brain. So again, staying within our lane, because, again, we don't treat these diseases, yet if there is a mechanical issue at the upper cervical region that could be affecting the way the brain functions, why not invite upper cervical chiropractic, and its specificity of this particular upper cervical area? Why not invite that in as part of the team? So the thoughts behind it and some of the studies that are out there behind it are particularly run by Dr. Scott Rosa. Dr. Scott Rosa, as well, he's a chiropractor. He's upper cervical chiropractor. He has a specific technique that he's patented called the IGAT technique. Again, one of the upper cervical techniques under the umbrella. And Dr. David Harshfield, who is a medical doctor. They've kind of teamed up and they have put together, several studies that look at many of these aspects, basically neurodegenerative diseases. So if you have interruption of the cerebral spinal fluid flow at this particular region, you can actually see on an MRI, you can see the internal jugular vein being occluded. You can see the internal parotid. You can see specific nerves irritated. You can actually see ligament lesions of the specific ligaments that support and suspend and help create all the movement with the upper cervical area. And you can also see some of the pooling that is occurring in the frontal lobe on MRI. And it specifically at Dr. Scott Rosa's office in New York, you can actually see, he does what they call a flow study, an MRI flow study, where you can actually see the movement of cerebral spinal fluid flow before and after the upper cervical alignment. And when that occurs, you can actually see prior to it, there's say specifically, I know he has got many where he shows in an MS patient where right there at the ventricles, you can actually see kind of a pounding pressure in those areas, and the lesions that they typically see in MS that create the diagnosis when a doctor looks at that, and they look at that and they can see where that cerebral spinal fluid flow is not moving correctly. It could be more of a pounding pressure rather than just a nice steady flow. Now, after the alignment, after the adjustment, they put him back into the MRI and do the flow study again, and you can see the actual changes of that flow. With it's more fluid, more movement going on there, and more normal. So if that was a contributing factor, again, these studies are still ongoing. If that is a contributing factor that is causing some of these lesions, and in turn maybe causing some of the autoimmune issues with the immune system we know now lies within the brain, called the lymphatic system. If that is the cause, and the immune system that is particular to the brain and its tissues are causing these lesions, wouldn't it be prudent to take a look at what upper cervical chiropractors do to be a part of the team that takes care of these patients? I know he does have one flow study, or probably several at this point, where you can actually see almost like a tornado of cerebral spinal fluid hitting the substantia nigra, which is the area that's typically damaged in Parkinson's. So you can see that. And, anytime there's any sort of, damage or, problem in the brain that could create some of these different neurodegenerative changes, I think it's important to look at the mechanics, because there's so much that's going on in the brain. I mean, every time your heart beats, that cerebral spinal fluid flow goes. You've got your veins coming out with bringing that CSF out when it's, no longer needed. And then you've got a lot of vascular things that are going on into the brain as well. So there's so much plumbing that's involved in the brain that if there's something cutting off that supply, to me, just from a mechanical aspect, it makes sense to take a look at these things. It's not that we're trying to treat them. We're trying to do what we do as chiropractors to make sure the system is flowing properly. That's hands down it. And there could be other things that the patient needs. But, a lot of these things that are happening with patients, they are, they're multi-layered. It may not just be one thing that's actually causing the problem. So why not look at all aspects and see how upper cervical chiropractors can be a part of this patient's healing? That's all we ask for the medical world, to take a look at what we're doing as upper cervical chiropractors, especially, doctors like Dr. Scott Rosa and, Dr. David Harshfield, who they actually even have a study in a medical journal called hydrocephalus, because it is so profound, the information that they're coming up with. So the fact that it hasn't really gotten a whole lot of traction in the medical community somewhat frustrates me. However, I do think that in platforms like this, that we can get patients into our office, that we can get chiropractors talking to neurologists, so we can come together and give these patients the very best care, so they can actually heal, or actually just have a better function in their life. To me, that is where we need to go. We need to start talking to each other as professions. And the fact that it's really hard to even get a phone call from a neurologist when I'm seeing a patient, even their own neurologist won't talk to me. So it's somewhat frustrating. However, I'm not stopping. This is another reason why I try and get this message out, that I want to talk to neurologists, that I want to talk to the community at large that has for so long been trying to help these patients. And what if, that one little thing could make a difference along with the care that they're giving as well? I just think that that's where we need to go next. Cerebral palsy is, in many ways, can be an issue that occurred at birth. A birth trauma is one of the things that I've seen most often. I don't see a whole lot of patients with cerebral palsy. Being treated, very young I would think help if there is a mechanical issue that is going on that we can treat. I think a better quality of life, even moving forward, because of their the way they move their body is so compromised because of the injury or because of the situation. Cerebral palsy is something that I think could help enhance a patient's life, whether it can reverse it. I haven't seen anything in the literature, but as far as, helping their quality of life is something that I have seen. Again, in the literature, I have seen that as well. So, that would be something, especially with this area where up at the very top, those are the area where the postural muscles are located, as far as the information where it comes from, down into, down from the spinal cord. That's that master breaker up there. So when we see somebody with a situation like cerebral palsy, it's all about enhancing their life, making sure that their brain can speak to the rest of their body in its very best way. Now, during the birth process, where sometimes, CP does occur, that area is definitely compromised. I mean, we do see studies all the time where even a normal, natural, at-home birth, where there's no medications, where there's no forceps or anything like that, that could actually cause, trauma to that area. And we still see, babies that have an atlas misalignment. It's not just traumatic for mom, it's traumatic for the baby too. So, one of the first things that we love to do is take care of not only our moms to make sure that everything is working well for them prior to delivery, but we also love to take care of the newborn babies. Both my babies, they're teenagers now, but they were adjusted with their very first atlas alignment within 7 hours of their birth. So they have lived an absolutely fantastic life. I always told my friends that I was jealous of my children before I even ever met them, because they were going to get chiropractic the first day that they were born. They rarely ever get sick. When they do, they breeze through it with no problem. They've never even had an antibiotic in their life. Never needed one, never have been prescribed one. They're ages 13 and 17 now, and that's actually unheard of. I always say they're unicorns amongst their peers. They have an amazing immune function. They have an amazing capacity to heal. They get checked regularly to make sure their atlas is in alignment. And I think it's probably been about 3 or 4 years since I've even had to adjust their atlas. So I'll check the rest of their spine to make sure it's functioning properly. Typically upper cervical chiropractors, we really focus on this area that is sacred. But, we also can look at the rest of the spine. Typically, we don't do any rotary movements. We're always very, very gentle with the chiropractic care that we give. Well, we do have some patients in our office that seem to have had vaccine injuries. If they come in, they said, I got the vaccine, no, this is happening. So some of it is within our patient base that we do see some issues occurring. And the great thing about what we do is that anytime a patient comes to us and says, hey, I have these symptoms, I have these issues, can you help me? One of the things that we do is we say, you know what? If there's a mechanical issue that we can deal with as a chiropractor, especially in this upper cervical area, and that is a contributing factor to what you've got going on, then we can definitely help you. As far as like maybe long haulers, with say COVID, those are things that we do see in our office actually quite often coming in, because they have some of the same characteristics coming in as what we do see a lot of is traumatic brain injury, like post-concussive syndrome. People that have been cleared by their neurologist and there's nothing happening up here in the brain like a brain bleed or anything like that. But they're still having some of those residual things like the dizziness, the vertigo, the migraine headaches. Sometimes they just can't think properly. And when they have those things, those are some things that we see regularly in our office and have shown significant improvement under upper cervical care. We do see those same things occur over time. So with long haul COVID, again, it's just a constellation of symptoms. I mean, it really hasn't been defined per se. Everybody has a difference. So people come in and they present that way. That's part of what their experience has been. That's not something I diagnose. Typically they've been diagnosed already before they even come to our office. So that's just part of their history. But when it comes to the same symptoms as those that have had a traumatic brain injury or suffering from post-concussive syndrome, it's like, even some of the blood work is exactly the same that they come in with. That, sometimes we have, blood work that's associated with traumatic brain injury. Some of the it's almost exactly the same. And to me, it's really kind of interesting because there has been some sort of brain injury that has occurred. And this is where a lot of the medical world is going into, which I find fascinating. And it's called the Denver study. They're actually looking right now as to how COVID, and I think possibly the COVID vaccine, again, that's something that I don't know about yet because there just hasn't been enough literature yet to actually speak on, but I do know they're looking into that as well. That what's happening is they're seeing these patients having some issues with their cognition, their mental state. Why is depression actually skyrocketing? With some of these people that haven't been diagnosed, again, just coming to my office with that diagnosis already, that's part of their history, that they're diagnosed with some of the same issues that occur after a concussion. So again, it's a study that's ongoing, so I really can't speak too much on that just yet because they're still kind of trying to recruit people. So if there's anybody out there that has been diagnosed or feels that they are suffering from long COVID, that it's called the Denver study. If you just look it up, they're still looking for patients. They're still looking for people to go through some of their studies to see where and how this relates to the same symptoms as a post-concussive syndrome. So I encourage people to do that because I think it's a very important study, one that's way overlooked and could really help a tremendous amount of people. And again, I'm out there asking these neurologists, can we play? Can we play in this game? Can we be part of the patient's care? Again, just doing what we do as upper cervical chiropractors, no more, no less, to be a part of this healing in these people. If there is a mechanical issue in this particular region and it can restore some of that flow of cerebrospinal fluid to help these people feel better, to get the pressure off that brainstem so they can start functioning more normally, is that something that we can be a part of? Would you invite us in, please? Because that is, I think, the missing link in so many people's inability to heal and get past some of these issues and heal at 100%. Yes, there are medications that can help. Yes, that's therapy that can help. Yes, there are things that can be done outside of that, but why not look at the basics, the mechanical issues that we can help and be a part of their team? That's all we're asking. That's all we're asking. There are specific blood markers that it's none of that. It doesn't have anything to do with, say, coagulation or anything like that. There's specific blood markers that are inflammatory blood markers, is what they are. So they show different stages of inflammation. So that's the basics of that. So they're a cascade of inflammatory blood markers that they're seeing in this study. And again, it's all preliminary. So, but I tend to get overly excited when I see some things like this occur kind of across the board and things that I see on a regular basis. And now this new crop of people that are coming in the past 3 years that have really been suffering. And again, they don't know where to get care. So, I haven't seen some of the same things come through that you would equate some of the side effects of COVID or the vaccine that have been, again, in the literature. But again, everything is forthcoming at this. Studies are very slow. That's not something that, you can... To me, I don't even jump into a study unless I see other studies that can kind of corroborate what they're saying. So I don't just take one study at face value. I want to make sure that there are other things that I can pull in that can really substantiate what the direction that they're taking in a study. As far as this study is concerned, again, everything is pretty preliminary because they're still looking for people to come forth and be part of it. But what they're seeing right now is so interesting. And I mean, there's even people that are coming out, even some celebrities that are coming out, that are stating that, I can't think anymore. They're, I feel like I had a concussion. There was one, I don't recall his name, but a basketball player that has been suffering with long COVID. And he basically stated that he feels like he has a concussion. And that's one thing that I saw that. And then I was like, okay, well, let's see what they're looking at. And that's where I found the Denver study. So I'm going down a rabbit hole as we speak with all this. And the patients that are under our care that have some of this cascade of symptoms, they are getting better. They are feeling better. And that's something that, and I'm only doing what I do. I'm not treating a disease or particular symptoms per se. I am just finding the misalignment, the subluxation at the very top of the spine here. I am adjusting it very specifically. And if the outcome is a patient feels better, has better range of motion, their muscles are less tense and irritated, their migraines or headaches goes away, their dizziness goes away, their vertigo goes away, well, then I've done my job. And sometimes there are other reasons for these things. Dizziness, it could be something going on with the ears, so I make sure that they get an appointment with their ENT to rule that out. So again, I can't stress this enough, that we need to start talking to each other in the patient care community. It's not just the medical community. We have to look at all of us coming together to really take care of patients and start talking to each other. You wouldn't come to me to get open heart surgery. And, a cardiovascular surgeon wouldn't do an upper cervical adjustment. So we have to look at how we can take care of each and every patient, and not look at our bottom line, but look at the patient's, standard of living. What is their quality of life? If you knew what we did and you knew that that patient could benefit from that, but you didn't know how to refer as a cardiologist, as a general practitioner, as a neurologist, if you didn't know because we couldn't get that word out, it's not that you're being a disservice to your patient. It's that you wouldn't be able to give your patient everything they need to recover and heal. I'm out there now trying to get that word out to these practitioners so they know how to refer to an upper cervical chiropractor. And again, it's not all chiropractors do this. Okay, it's a specialty within the profession that does this. It's a very specific form of work that takes very specific films to get vectors that are associated with each individual patient to adjust it very precisely and very gently. And when we all come together, the person that wins is that patient. And each and every patient matters. They deserve the dignity of a diagnosis. I can't tell you how many patients walk into my office. They feel like they're crazy. Nobody's listening to them. Nobody knows how to take care of them. And we're typically the last place that they come to, which I find really sad. But then I also go, okay, well, who are you under the care of? Because I would like to talk to them. I want to know what's been done, what tests have been done, so we don't redo another MRI, or we don't take these x-rays, or we don't do this, send you off for, some neurological testing, things like that. I want to know what they've had done. And then when I get that information and I try and contact their practitioners, I get crickets. So now here I am with all this information, and I have very, little to really go off of. It's really disheartening to me to know that they haven't gotten any help where they are now. Maybe minimal. Probably not any, but they still don't feel like themselves. They don't feel comfortable in their own skin and their own lives. They can't perform their job like they used to. To me, that is really sad. And I just want to get the word out that there is hope. There is hope. And I want to make sure that the medical community starts talking to us so we can be a team in these people's lives. I don't do what they do and they don't do what I do. Yet if we come together, that's going to make the biggest difference in the world for these patients, and they're going to start living their lives again. So in our office, and I think in our office and most upper cervical chiropractic offices, we typically don't adjust on the first day. We like to take our diagnostics very seriously because, first of all, we have to know if you're an upper cervical candidate. Very rarely, but sometimes we do have patients come into our office that have something that we find during their examination that would preclude them from getting upper cervical care or chiropractic care in general. So we would need to refer them out. So we don't adjust anyone on the first day until after the diagnostics. Now, our new patient protocol It's a 3-day protocol. I know that sounds kind of excessive, but again, we want to make sure that each and every patient not only is a candidate for what we do, there isn't anything else that would preclude them from getting an upper cervical or chiropractic adjustment, that they understand the process of what we're doing, why we're doing, and they know what's going on with them. Why do they have these issues? You know, one of the big things that I hear from patients is, why didn't anybody ever tell me this before? Why had I been suffering for a decade? To me, that is, again, that whole sad thing that they should have gotten this information, or at least had a doctor know to refer them to an upper cervical chiropractor. So on that first day, we do a consult. I want to know what's happening from top to bottom, what they're experiencing, what other diagnoses have they gotten from other practitioners, their history, their traumatic history. I mean, how many auto accidents have you been in? Did you get hit by an 18-wheeler, or did you fall off a ladder? I mean, all those things make a difference. And we try and go back as far as possible, even to birth, because what we do know is that, as I mentioned earlier, that the birth trauma can actually follow you well into your adult years. So we try and go through as much as the history as possible. And then we are going to, I want to feel the spine. I want to see what's moving, what's not. I want to get feedback from that patient so we know exactly what's going on with their body, and to know what areas are sore. What areas aren't moving properly. That's where we look for subluxation and misalignment of the spine. So we look for all of those things. Then we look at posture. We like to say posture is the window to the spine. So when you are out of alignment, especially up here at the very top, that actually will cause a shoulder to go high, a hip to go high, a leg to go short. So we're actually looking at all the aspects of how those postural muscles are affecting their spine, are affecting their body mechanics. So we're going to look at posture. And I mentioned leg length. So I have them lie on their back. I want to make sure that their leg length is nice and even. If it's not, that's one of the first neurological signs I can find that something is going on all the way up here, because that leg has been pulled up due to a muscle spasm, because those postural regions at the brainstem are not functioning properly and could be caused by that misalignment at the very top there. Then this is all the same day. We're going to do 3 different scans that really look at the function of the nervous system. Really talking about symptoms is roughly about 10% of what's going on, because our nervous system really only has enough pain fibers to give us that information, about 10%, okay, that give us that the information. So there's 90% that you can't tell me. And I just don't want to take care of 10% of patients. I want to take care of 100% of patients. So when we do these 3 scans, the first one is called a thermography scan. This looks at the nerves that go to your organs and glands, or that autonomic part of the nervous system. You don't have to think about what's happening. You don't have to tell your heart to beat. You don't have to tell yourself to breathe. So it looks at all the functions of that. So it's a very sensitive thermometer that rolls up the spine, that allows us to take the difference in temperature on either side of the spine. You would think that a space of this big would be the same, but actually it could be quite different if there's any inflammation or irritation at those nerves right where they exit the spinal cord. So we do that. Then we take a look at the nerves that go to the muscle tissues. So this is looking at the nerve impulses using it's called an SEMG, or surface electromyograph. And we look at that to see exactly how those nerves are functioning going to your muscles. So again, that's going to give us further information to if there's any compromise to those nerves exiting the spine, going to that muscle tissue. The last test we do in this group is called heart rate variability. Now, heart rate variability is something that's actually becoming one of the gold standards in many cardiovascular offices, to take a look at how stressed out a patient is. Now, it's not just the emotional stress you're thinking of, but our bodies can be stressed out on the inside to being not at ease or disease. So that's where they look at it. And in our view, we look at it to how resilient is this patient? How well are they able to deal with stress, whether it be chemical, physical, or emotional? And this chart will actually help us find out essentially how well are they able to heal. So if you're constantly running away from a tiger because your body is stressed out on the inside and all the other outside stressors that are coming in, your body is not interested in healing. Okay, it's interested in getting away from that tiger. So what this takes a look at is how well that body can heal, to give some proper expectations to that patient and to give them a goal to reach, to say, the more at ease your body becomes, the better this test is going to show. Then from there, we actually do x-rays. After we've done that, we'll know exactly how to approach the x-rays, the most important of which are the upper cervical films. We take a lateral view, then we take a frontal view, we also call the nasium, and then we take a back view here that also looks at how the rotation that's occurring in there. So when we see that, we're able to see all aspects of how that bone has moved. Has it shifted? Has it tilted? Has it rotated? We want to look at all the aspects of how that particular bone moved so we can put it back in proper alignment. That's how we get the vectors on those. If there are issues in other areas of the spine, say in the mid-back or the low back, we'll take those views as well to determine exactly if there's anything going on there, especially if it's their area, the prime area of concern. After we do that, they'll make 2 more appointments in our office. The first one is when we go over everything. We're going to tell them their why. Why are they feeling this way? Are they a candidate for our care? They're going to know top to bottom exactly what's going on with them from a chiropractic upper cervical perspective. Then after that, if we determine that they are a candidate for our care, then they'll receive their first adjustment on that visit as well. So they'll only have to wait till the next visit to get their first atlas alignment. On that day, we adjust atlas only. It is sacred. When the atlas is out of alignment, it is the number one thing. Again, we got to turn that master breaker on so the rest of their body can start to unwind and start to heal. Then they'll come back for a follow-up. And that follow-up is going to go over, how did they do after their first alignment? What changes did they notice? Then from there, we'll be able to determine their course of care. We'll give them a plan, based on their before and after, results, as well as, our clinical judgment. We'll determine how we actually correct this patient's spine and get it working for them in the way that it was designed to do. Sometimes that has to do with actually correcting the structure of the spine as well. I like to think of it as like orthodontics for the spine, but we start first with the atlas to make sure that those postural muscles are functioning properly and we're not, trying to adjust into this big muscle spasm on one side. And from there, a patient will get a plan that they can look at, and they know exactly when their next progress exam is going to be, what they should expect as far as their healing is concerned. And we base that all on clinical models that we've seen over the past 17 years. But it gives patients kind of finally a plan that they can not only adhere to, but contains no drugs and no surgery. And typically that's what patients are looking for because they're tired of that approach. Sometimes we have to, work together in that arena where, sometimes medications are needed by their prescribing doctor. But what we do get to see, which I think is quite fun, is so many patients that no longer need their migraine medication over time. And over time they can talk to their prescribing doctor and they can say, I really don't need this. And, more often than not, we do have many doctors that are very supportive in helping their patients, wean off some of these medications. So you get to see that, and that is just a win for that patient. And they're no longer, they no longer have to worry about, having to refill a prescription or continually deal with just the symptoms they came in with in the first place. It's kind of, I don't know, it's surreal to be a part of that process. Typically, it always depends on the patient. And it also depends on the patient, what they want out of their care. Typically in our office, and again, each practitioner, each upper cervical chiropractor has a different approach. And holding their atlas alignment is key. That's the one thing that we try and stress with our patients. The longer they hold their atlas alignment, the more stable and their spine becomes. So the more changes we can make structurally from there. Now, in our office, if you are a patient that, say, comes in with a head or neck injury, especially a history of migraines, traumatic brain injury, or any of those things, tinnitus, vertigo, typically I'll see you twice a week for the first 6 weeks. We want to make sure the atlas is holding. We want to make sure that we kind of passed that initial time frame that created the problems in the first place. So typically between 4 and 6 weeks, we want to see at least a 50% or more reduction in those symptoms they came in with. That's really important. That's the area that we start doing also our progress exams to kind of touch a base to see not only how are they doing after that particular period of time, but also we have diagnostics that we perform during that time that will kind of link those two together. That 10% they can tell us and the 90% they can't. So we can really take a look at what's going on in their nervous system from an objective standpoint. If we do not see from, again, their perspective that they are having that at least 50% or more reduction in their symptoms, then that's when we kind of pivot and we switch gears. I want to see them at least once a week during that time frame. Sometimes we'll expand that twice a week depending on how they report to us. However, we could be doing things like maybe changing up their exercise program, maybe taking away or modifying an exercise. We could be adding in a new therapy to kind of help them pass this issue. And in some cases, we'll even do advanced imaging. Like there's a specialized MRI protocol that we use specifically for the upper cervical in the upper cervical world, where it's an upright MRI. They're kind of peppered throughout the US, but I'm fortunate to have one just 10 minutes from my office and a tech that is absolutely fantastic, who knows exactly what I need to see, but is a very specific MRI that looks at the atlas region and uses a technique that I can visualize those ligament structures very, very well as some of the vascular structures that could be impeded as well. So that way we can get a full picture of what's happening. But I typically don't like to jump to the more expensive testing or do anything that could cost, excess amount of money at the very beginning unless it's warranted, particularly something that I see on the films or maybe their history. We may go straight into doing that MRI right away. But I really like to make sure that we kind of see some change before we actually jump into any more testing that may be involved. But overall, if our patients just want to stay in alignment, we do have, that as well, where they can come in on an as-needed basis. That would be more care like when they start to feel symptoms again. Our goal is to really get you to the point to where you don't feel symptoms, to more preventative of care. So we can actually correct the problem to begin with, change and enhance the structure of the spine so these things don't come back, and prevent further degeneration along the way. So ultimately, the answer to, how often do patients need to come in really depends on what the patient is looking for in their care. If they're looking for corrective care, then it would be more often over a long period of time, typically 1 to 2 years for correction. But if they're looking for more symptomatic care, then again, we'd like to see them at that initial 6 weeks to kind of make sure we get past that symptomatology. And then after that, they can come in on an as-needed basis. So again, it's just depending what the patient is looking for. Not everybody's looking for correction or has time for that, or that commitment level is just not there at that moment. But we're here to take care of patients in any capacity they wish to come into our office. Our main objective is to give you our very best recommendations, but it's up to you to tell us how much of it that you want. Well, one of the things that we tell patients as far as the upper cervical alignment is there are some responses that our patients get, especially after that very first upper cervical alignment, where there could be a detoxification response. Some actually get kind of like a detox headache. I'm not sure if you've ever heard of that before, but sometimes when the body's trying to rid itself of toxins, you can get a mild headache. That's why we tell them to drink lots of water after the alignment. There's also some people have some loose stool afterwards as well. So again, that's another detoxification thing that we do see quite often after that first atlas alignment. Again, it's nothing that would necessarily cause distress in any way, but it's more or less just something different that a patient does feel after an atlas alignment. I do recall Dr. Scott Rosa. He actually he takes care of one of the Chicago Bears. He's a former player who. His name is Jim McMahon. You can actually see a lot of his interviews talking about Dr. Rosa's care. And he actually felt after that alignment, now he was super toxic. He was having all sorts of brain issues. He was violent in nature on many, many medications. And he was to his wit's end, so much so he was becoming suicidal. And his story is really profound because he said that when he got his first atlas alignment with Dr. Scott Rosa, he said that it felt like a toilet flush, like his brain finally just flushed all that toxic waste out of his brain, and he was able to finally think again. That is really, that's very descriptive, obviously, but when that cerebral spinal fluid can't really exit out of the brain because of that bottleneck at that brainstem, it becomes essentially swamp water up here at the frontal lobe region. And so that detoxification effect can occur after an atlas alignment. And that's where I think we see a lot of patients refer to it as kind of a detox response. So when it comes to any sort of insult onto the body, whether it be medication, whether it be any sort of medical intervention that could have caused some sort of, toxic issue. Drugs are drugs. They're meant to be regulated as drugs because they're somewhat toxic to the body. That it can actually cause a detoxification response. Now, as far as how it can relate to any of the things we're seeing over the past 3 years, I don't know. That's a question, again, I would have to quantify with studies to see exactly how it does, specific studies, how it does correlate with any of those things. But what I do know is even prior to all this, that patients do have some significant detoxification responses that are very profound and welcoming, and they feel more clear and like they can think and they can live their lives again. So that's probably the best answer I can give as far as how it can help detox the body. Well, as far as supplementation to help with, there are several different supplements in particular that I really like to use. One is hemp oil. I prefer the Thorn product. That it's the entire molecule of hemp. It's not just CBD. And that really helps. It's very anti-inflammatory. It's high in omega-3s. And it really does help to kind of decrease some of the anxiety symptoms that patients may have. There's a lot in the literature that shows that. And this is not something, again, that I treat or diagnose, but it seems to really help with some of the inflammatory components with a traumatic brain injury, post-concussive syndrome. There are also things like Bacopa complex from Standard Process that, again, is an anti-inflammatory product that works fantastic with these people. And, you want to make sure that you're getting plenty of the omega-3s, the anti-inflammatory products. As I mentioned, it's in hemp, but also cod liver oil is also a big staple in our office as well when it comes to that. B vitamins are essential because their body's been zapped, essentially, with all the stress that it's under. B vitamins are the #1 stress vitamin. And then you're looking at magnesium. Magnesium is something else that is, again, can burn through like a fire through kerosene in the body when the body is under stress, particularly the brain. So you want to make sure that patients have enough magnesium, as well as a lot of the synergistic minerals as well. You've got everything from, your calcium. You've got, selenium is also another one that's really important for this. So we have a wonderful product called Mintran as well that contains a lot of these minerals. It's named as mineral tranquilizer. That's where that name comes from. But it's basically the minerals that really help calm the nervous system. So that's another one that I really like as well. And, it's based upon how the patient presents. Not every patient has, some of the constellation of symptoms is a typical traumatic brain injury patient, a post-concussive syndrome patient. They may have just extreme fatigue, and that's all they have, and they can't sleep, so it kind of goes back and forth. So it depends on how the patient presents. But the staples for me, I believe, are the hemp oil, the cod liver oil, as well as the minerals. Those are the three that I hands down recommend to all of those. And then again, there are some other products. Again, there's a plethora of them, so it's kind of difficult to say all of them. But it depends on how a patient presents, of how what I would recommend to a patient. And I don't want to, shove them full of pills either. They've been there, done that. I want to make sure that they are getting everything that they need to properly get the information. Okay, this is one of my favorites because not everybody thinks that this can affect this, the gut. So if you look at the structure of the spine and how the upper cervical the upper cervical region relates to the entire nervous system, you'd be surprised that there is a nerve called the vagus nerve. It's one of the cranial nerves, and it is also called the wandering nerve. It actually controls the balance of the autonomic nervous system. The autonomic nervous system, which controls your organs and your glands. So it starts all the way up at the brainstem. And we can actually see it. There's the specialized MRI that I was speaking of earlier. You can actually see that vagus nerve compressed on the MRI when there's especially a lot of rotation and lateral shift. You can see it actually compressed. Now, we all know that a compressed nerve does not function properly. So when we have an atlas misalignment, it can actually cause some issues with your gut health. Now, when we're talking about, let me just start. There's many aspects to this. I'm glad you asked this question. Is when the vagus nerve is irritated or compressed, that actually can cause issues with the peristalsis in the gut itself. So we're talking just the basic function of the intestines. If we don't have that specific peristalsis in the gut, we actually could have things like constipation. When people are super stressed out, constipation is a major issue. So that also becomes, toxic. They feel sluggish and slow. They're not hungry. There's all sorts of things that can actually occur, and that can actually cause, too, some other problems with as far as the microbiome is concerned. In the literature, it does state that a large majority, you can get anywhere from 80 to 90%, depending on what study you look at, that our immune system lies within our gut. And if the peristalsis isn't functioning properly, if we're not getting the right food into our body, if we're not eliminating properly, then we're going to have a disruption of the microbiome in that area. Our microbiome predicts how we actually feel, that mind-body connection. That there's so much out in the literature now. It's actually pretty exciting, where you can actually find that when the microbiome is not in balance, then you're not going to feel good up here. The majority of our serotonin, that feel-good neurotransmitter, 95% of it, again, depending on which study you read, is in the gut. It's not in the brain. So If that vagus nerve is not functioning properly because you have a misalignment all the way up here, again, not only it can affect your gut, but it can affect how you think, how your brain feels. So because you're not getting that influx of serotonin, the good guys, a good microbiome in our gut manufacture the serotonin. That is their job. And the less you manufacture, the less you'll have up here, and the less you'll feel like yourself. The less you'll feel, happy. The less you'll feel motivated. It's all those things that come with that wonderful neurotransmitter that gives you that sense of well-being. So with an upper cervical alignment, again, should that mechanical insult be there at the upper cervical region and it's affecting that vagus nerve, it can cause a cascade of events all the way down to the large intestine. It touches almost every single organ all the way down to the large intestine. Well, I just want to make sure that people know how to find an upper cervical chiropractor because, again, it is a specialty. Not every chiropractor does utilize this particular form of chiropractic. All chiropractic works. I just want to put that out there too. I love all of it. But again, this is something that, only specific chiropractors do. I'd like to give you some information to try, to find one. If you want to find an orthospinalogy doctor, you want to go to orthospinalogy.org. You'll be able to look up a doctor in particular as that specific upper cervical work technique. But if you want to find a chiropractor in your area, you can go to uppercervicalcare.com and you just plug in your city, your state, or your zip code, and it will populate a group of chiropractors that where they practice, how they practice. It'll give you links to their websites, so you can look there as well. If you want to look into a little bit more about the diplomate program that I went into, there's less than 100 of us in the world that have actually gone this far over the past decade of these classes being given. If you want to find more about what that is and the work that we did as upper cervical practitioners to take this extra step, you can go to the International Chiropractic Association's Upper Cervical Council website. Just put that in there, and you can find out about the practitioners there. Find one in your area, possibly. But if you'd like to just speak to me and you're in my area in the Plano or the greater DFW area and wish to come see me, my website is drjenn Taylor, TAYLOR.com, Dr. Jen Taylor with 2 N's.com. Or if you just want to chat, you can always contact me through there as well. If you want me to find you somebody that I trust in your area, hopefully I know a practitioner that can help you. But I'd be glad to chat with anybody out there if they had any further questions, or if they'd like me to talk to their doctor and give them some more information about what we do. I'd be happy to do that as well. I do have a lot of patients because the fact that I do have the DCCJP after my name, that extra, 3 years of work. They do come to see me from other states. I have several that travel. Typically what I ask is during that time that they come and see me for a week. Like we try and get those 3 appointments in within a week's time frame. So you'll need to at least commit to that. And then if they choose to continue with their care, I typically do try and find somebody closer to them. Again, it's one of those things that's kind of difficult to find in smaller towns, smaller cities. But we'll be able to find somebody closer that you wouldn't have to drive 10 hours or fly and stay in a hotel or anything like that. So typically what I would do is require come in for a week. And that way we can get those 3 visits. So you'll get your initial consult and examination. You'll come back for your first report and alignment. And that 3rd visit, we'll talk about, what's next, what I expect, as well as maybe getting you to a doctor in your area. So we'll start in my office, and then we can actually transition you to a doctor in your area. So I do have a lot of patients that decide to do that as well. Or And like I said, I will find somebody in your area that I know and trust. I've got a lot of people that I know all over the country and even in Canada that I would be able to refer you to if you choose to do that as well.